Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you have symptoms like an unexplained fever, or maybe you have severe joint pains, or maybe you're experiencing sudden unexpected weight loss, then your doctor may have recommended something called the ESR blood test. And today, I'm going to tell you everything that you need to know about this simple blood test. So what is an ESR test? What is ESR? Why is this rather three letters put together this way that we call ESR? And I'm sure you as a patient are really confused about this. So what you need to know is that our blood contains a lot of small tiny little things called red cells. These are the cells that give the color to the blood. Now if we took a sample of your blood and placed it in a tube, it takes some time for these red blood cells to settle to the bottom of the tube. Just imagine like you have some muddy water in a tube and if you just let it rest, after a while you're going to find that the mud settles down to the bottom and the water is on the top. The same thing happens with the blood. The red blood cells slowly settle to the bottom of the tube. The ESR test, which stands for Erythrocyte Sedimentation Rate, and I'll explain what that means, is a test that measures how fast these red cells settle to the bottom of a tube. Erythrocyte stands for the red cells. Sedimentation means the process of settling down to the bottom of the tube, and rate is the speed at which this happens. So the ESR basically tests how fast your blood cells move to the bottom of the tube. And this is important because the faster they move to the bottom, the more the chances that you have some kind of an inflammation or swelling developing in your body. So what are some of the symptoms that could mean that you should get this test? Honestly speaking, this is one of the most commonly prescribed blood tests by doctors all over the world. Anytime a patient visits them with symptoms like fever, fatigue, joint pain, muscle aches, headaches, weight loss, swelling, or even stiffness, this test is probably going to be recommended. These are very generalized symptoms and all of them point to some kind of an inflammation or swelling or a reactive process going on in your body, and doctors try to find out whether this is the case, and the ESR is very useful for us to know this, because if the ESR level goes up, it means there is some kind of an inflammation or an inflammatory process or swelling developing somewhere in your body. So why should you get this test done? What are doctors trying to find? The first and most common thing that an elevated ESR tells us is that there is an inflammation or a swelling or a reaction somewhere in your body. Number two is this test is also often elevated in autoimmune diseases like rheumatoid arthritis, in which you have swelling of the joints, or lupus, which is another autoimmune disease which may show up with a rash on your face. This is also a useful test to check for disease progression. If an inflammatory disease like say arthritis is subsiding, we might find that the ESR values actually improve. Other than this, it is also very commonly done when you come down with a fever or a cough or a cold, because doctors want to know how severe it is and whether it is could be viral or it could be bacterial, the type of infection. Lastly, it also helps us to know the response to treatment, because ESR will come back to normal once the inflammation or infection has subsided. So how is this test performed? ESR is a simple blood test. A single sample of your blood will be drawn from the vein in your arm, and that will be tested in the lab. You will have the reports within a couple of hours. No special preparation is needed for this test. You can do it at any time. You don't have to be fasting before the test. You can take all your usual medications. It's important to remember that some painkillers may affect the results, so tell your doctor if you're on one of these. And lastly, the values are reported in terms of millimeters per hour. If you've been following along with my explanation, you will realize that this is how many millimeters your red cells have settled to the bottom of the tube at the end of 1 hour. What is the normal range for the ESR test? So it depends on gender as well as age. In men between 0 to 50 years, the normal value is 15 millimeters per hour. Above 50, it is usually less than 20 millimeters per hour, and in children, it's less than 10. In women, the values are slightly higher. Between 0 to 50 years, a normal range is less than 20 millimeters per hour. Above 50 years, a normal range is less than 30 millimeters per hour. In children, it's the same. And in pregnancy, you must remember that the normal range of the ESR is much higher than in a non-pregnant woman. I've made a separate video about ESR in pregnancy, so please check that out. So which are some common diseases that we might be able to diagnose by the means of a test like ESR? So rheumatoid arthritis, which is swelling and inflammation of the joints, this is an autoimmune disease, and your ESR will most probably be elevated if you have this disease. Secondly, infections, bacterial infections, viral infections, fungal infections, especially of the chest or of the brain or even anywhere in your body. Common amongst these being things like tuberculosis, especially in developing countries like India. All of these would cause your ESR to rise. Giant cell arteritis, this is a disease especially found in men above the age of 50 or 55, where there is a swelling or inflammation inside one of the blood vessels which passes near the forehead. That's just a generalized landmark for you. There's inflammation in this vessel. It can cause blindness, it can cause severe headaches, and this is one of the most common reasons for which ESR gets elevated in this specific population and age group. Multiple myeloma is a cancer of the blood cells in which your ESR values will rise, and other than this there is a whole host of other diseases, cancers, inflammatory diseases, autoimmune diseases, infections in which the ESR can rise. Important to remember that the ESR can simply rise even with age. Older people, especially those in the geriatric age groups, have much higher ESR values than younger people, and this doesn't mean that they are sick. Also, if you have anemia, which is a low level of hemoglobin in your blood, your ESR will rise. So it's important to remember these exceptions, but this is just a list of common diseases that I've given you here in which your ESR level will rise.